I'm a hand therapist, an occupational therapist, and a cognitive neuroscientist, and I've kind of combined all these wonderful skills and knowledge and expertise together. And first and foremost, I'm very much a hand therapist, and that's the large majority of my clinical caseload. So everything is integrated to support my clients with upper limb injuries. And I have gone down this rabbit hole of neurotechnology, and I specialize in the use of non-invasive brain stimulation, which is an amazing piece of technology to influence the brain in a very positive way. I always have felt as a therapist that we haven't been very well trained for the management of chronic pain. And this is what led me to my work at the moment. And so this device is a great way of successfully treating chronic central sensitization and central nervous based pain. It seems quite straightforward, but before I even do any work with the device, it's really, really important to focus on the different pain mechanisms to begin with. So for next month, the presentation will focus on how to actually successfully and accurately assess different pain mechanisms and how we can potentially use the non-invasive brain stimulation for the treatment of inflammatory-based upper limb disorders where they are presenting with central sensitization. So a lot of things to be covered. I won't go into huge depths because I think a lot of people are very new to non-invasive brain stimulation and also different ways of assessing central sensitization. So I will give an overview of each of those sort of subsections and try and create more time also for the discussion side, because I think that there probably will be a lot of questions, and then perhaps that will also help us to understand what people need to know more about and how to fill that gap, really.